Greetings. My name is Ayale Teferi. I am a professor of medicine and a consultant in hematology at the Mayo Clinic in Rochester, Minnesota. In the current video segment, I would like to alert you very important communication that's going to be published in print in the August issue of the Mayo Clinic Proceedings and posted online on July 24 of this year. This article was prepared in order to support a patient-driven initiative and petition with a link that could be found at change.org. And this is an effort that patients themselves are doing to lower these high cancer drug costs. One of the major challenges of the increase in population growth, and especially with our aging population, is the increase in cancer burden. Just to give you an example, in 2013 alone, worldwide, they're estimated to be approximately 15 million new cancer cases and about 8 million cancer deaths in that year alone. Fortunately, we've made important advances in the prevention and treatment of cancer. And in this regard, there has been a number of breakthroughs, including molecularly targeted therapy and utilization of our own immune system, the so-called immune therapy. Unfortunately, along with this very exciting advances comes a very high cost of cancer drugs, which are putting a lot of burden on our patients as well as our healthcare system. The simple fact is that patients simply cannot afford these new drugs, and more importantly, most patients, especially worldwide, do not have any access to these exciting new drugs. To give you an example, in 2014, the average cost of new cancer drugs that are approved by FDA are estimated to cost annually over $120,000 US. Now, the current trend in insurance coverage dictates that about 20 to 30% of that is out of pocket by the patient themselves, which means that it costs about $25,000 to $30,000 for a patient, and this could be repeated if there are other cancers in that same patient or someone in the family. This is more than half of the average household income in the United States, and equally important is not just the financial burden on the patients and the families, but also our healthcare system that's got its own issues as well. Therefore, in this article, we try to highlight these issues in great detail, as well as provide some approaches to solutions. The article, which is authored by over 110 cancer experts, including more than 30 past presidents of the American Societies of Clinical Oncology, Hematology, and Cancer Research, elaborates on these issues and submits proposals in order to find some solutions. The solutions for this problem are hard to come because the drug companies, for the most part, hold the cards in terms of deciding how much we have to pay for them, or the patients have to pay for them. The issue at large, we believe, is directly harming patients and their families. And it is a crisis, an ongoing crisis, that needs to be dealt with as soon as possible. This undermines our Hippocratic Oath and undermines our responsibilities for our patients. Thank you very much.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.